All right, so with our glucocorticoids, we have a lot of different names for them, depending on the route that we give them on. So I have some of them listed right here, whether it's an inhaled glucocorticoid, an oral, or an IV. We use these in patients who have asthma to decrease that inflammation in the airways. So we know that we use these a lot for maintenance medications. Um, so that we hopefully can keep that inflammation down. We use this for our patients who have arthritis that have that joint inflammation. We know that by decreasing that inflammation, we decrease the pain, and then we also help improve the range of motion so that they can use those joints. And then we use this for patients who have had an organ transplant. Um, this is going to help their body hopefully not reject that organ that they've received. So some contraindications for our glucocorticoids are going to be anyone who has recently had a live virus vaccine, because we know that our glucocorticoids are going to interfere with our body's immune system. And so, by giving, if they've had a live virus and their body's trying to actively fight off that infection, and we kind of decrease the effectiveness of that immune system, then they're at risk for becoming ill. We also want to be very careful with patients who have had any systemic fungal infections. And then, of course, we know that we have to be very, very careful if patients already have diabetes, because it's going to interfere with their blood sugar. And then just be careful with patients who have hypertension, heart failure, peptic ulcers disease, because it could irritate some of that gastric lining. And then osteoporosis, because we know that it's going to cause bone loss and any kind of kidney dysfunction. So some drug interactions that we're going to see, thiazides or loop diuretics are going to, so those medications are potassium depleting. They're going to get rid of potassium in your body, and we see that our glucocorticoids also do that. So if you use those concurrently, we are putting our patient way at risk for that hypokalemia. And then concurrent use with NSAIDs is going to increase the risk of GI ulcerations. So we want to make sure that we're very careful with that. Adverse effects for our inhaled medications, they may have difficulty speaking or hoarseness, but we worried about those candidiasis or your thrush, your fungal infections in your mouth, like you see right here. They can very much get those. That's something people don't often think about, and they come to the clinic or whatever, and they're like, I have these white patches, what's going on? So be on the lookout for that. As we've already talked about, it can suppress the adrenal gland function, so we have to be very careful when we're tapering off those doses, and it can also lead to bone loss. For our oral route, we want to be, again, looking for that suppression of the adrenal gland. We have bone loss. We know that it's going to cause hyperglycemia, so we need to be watching those blood sugars even more so with our diabetic patients, because it's going to throw their glucose controls kind of off a little bit. It could cause peptic ulcer disease. They're at an increased risk for infection just because it kind of interferes with our immune system. We see some weight gain and edema. That's an unfortunate side effect. And then we need to be on the lookout for that hypokalemia that I just mentioned. So we know that any deficiencies or too much of potassium is going to mess with our heart. So bad stuff can happen from that. So as a nurse, we need to make sure that we be on the lookout for that oral thrush if they're inhaling it. Monitoring our blood glucose levels periodically. So we want to make sure to let them know that that's something that we're very much going to have to monitor, even if they aren't diabetic. and do not abruptly stop these medications. And that's a huge teaching point for the patients as well, as we know we can't just stop them because we don't want to do that anymore. We have to taper your dose. We want to make sure on our patient education that if they are showing signs of an infection, those telltale signs that we've talked about over and over again, they need to see the doctor to make sure that they don't have an infection. Make sure that we have a sufficient amount of calcium and vitamin D to avoid or offset the possibility of that. Checking their sugars, especially those diabetics, they may have to alter their insulin needs. Making sure that we avoid NSAIDs and report any signs of GI bleeds. We want to make sure that they take this medication, like the oral route, with food or meals. For our inhaled route, make sure that they rinse or gargle their mouth with water so that we don't increase our risk for that oral thrush. But to monitor or to report any oral redness, sores, or white patches, so that we can treat them for that infection. And also just letting them know that these asthmatics that they should not take their glucocorticoids when they have an acute asthma attack. Remember, we want to give our bronchodilators first, and then they can take their glucocorticoids. And that is all I have for this one.